what I'm going to demonstrate here today is the nerve conduction study portion of an EMG. An EMG test is broken up into two portions. The first portion is the nerve conduction test, where we essentially shock your nerves with this stimulator to produce a response on the screen. What it does is it tells us information about the nerve, how fast it's firing, if it's in continuity, if there's any damage to the fibers itself. What we do is we get this data and we compare it to a set of normal values, and that helps us try to determine whether there are certain conditions that are going on in your body, such as a neuropathy or any sort of nerve damage. The second portion of the study involves taking a needle, an acupuncture-sized needle, and inserting it into different muscles and looking at how the nerves and the muscles communicate and talk. And those two together give us an idea about what we're dealing with. An EMG and a nerve conduction test is not 100% sensitive for everything out there, so you have to keep that in mind, but it does give us great data. It is an uncomfortable test, but we work with you to make sure we can get your comfort level as best we can. All right, so you're going to be hooked up here to these electrodes, and these electrodes are going to go into this box, which is connected to this computer. We take some conduction gel here, which will feel a little cold on your skin, and we measure a distance of whatever we need to. It's usually 8 to 14 centimeters here, and then we shock the foot. And if it's a motor nerve, the foot will jump because we're actually sending a shock to the motor portion, and we want the foot to move. The sensory nerves will not cause the foot to move or any muscle activation, but you will still feel a shock. Most people describe it as a rubber band being snapped against the skin, and the motor nerves cause a little bit more sensation than the sensory nerves when we study them. So an EMG is usually ordered for neuropathies to try to characterize what type of neuropathy we're dealing with. There are multiple types. The most common cause of neuropathy in the US is from diabetes. The most common cause worldwide is idiopathic, meaning we just don't know. But there are other causes of neuropathies that are more acute, like Guillain-Barré and other demyelinating neuropathies that an EMG can help diagnose. Another condition that we commonly see referrals for is a radiculopathy, or a pinched nerve in your back. And to do that, we do the nerve conduction test and the needle portion, because the needle portion is more telling for radiculopathy than the nerve conduction studies. We also do this test to check for other neuromuscular disorders such as myasthenia gravis, ALS, and other motor neuron diseases. So we can check for what we call focal entrapment neuropathies like carpal tunnel, and in the leg you can have foot drop from a perineal neuropathy where the nerve is entrapped here. And in the arms, carpal tunnel ulnar or cubital tunnel syndrome. And we can also check for plexopathies, or nerve damage to the plexus of nerves as it comes out of your spine, or also the nerve root itself. So EMGs can get real fancy, but for the most part, it's either carpal tunnel, peripheral neuropathy, or radiculopathy.